So I just finished my first year of residency. It was called a transitional year, and I'm going to give some of my thoughts. Now, a transitional year is a year that you need to do before moving on to your actual specialty. So for example, my residency will be in physical medicine and rehabilitation, but you need to do an intern year before that. Now, this can come in a couple different forms. It could be a transition year, which I did. It could be a just regular intern year spot. So we call this a categorical intern year. It could be a surgical intern year as well. And when you're applying into certain specialties, so that includes dermatology, anesthesia, radiology, PM&R, there's a couple others, you're gonna need to apply for two different programs essentially. One being your residency and the other being the intern year that you're gonna be matching into. And a lot of people will say, depending on your specialty, that you should do like a harder categorical intern year or a surgical intern year, but I loved my transition year. Now, generally, transition years are supposed to be a little bit easier. I think it can totally depend on the hospital that you're at, but I do feel like my year was probably not as bad as some of my friends that are doing categorical internships in the city. And was I happy with that? Yes, I was, because I'm not going into internal medicine. Now, a lot of people will say, don't do it because now you're not going to feel as competent going into your second year. And I would give some pushback on that. I think maybe it's program specific, but even though I don't feel like my year was probably as hard as other people that were in hard, let's say, intern years in the city, I feel very confident going into the next year and did many months of floors in internal medicine still, and was able to develop those skills and learn how to be an intern and take on patients. I also feel like my medical school prepared me well, so maybe that has something to do with it, but I definitely got good experience working as a physician in medicine. Additionally, another reason I liked the transition year is because I had a good variety of electives as well. So I had a radiology month and anesthesia month. Those were built into the actual program. I also was able to do a sports medicine elective, which is something I'm very interested in. I was able to do a research elective. I had time in the outpatient clinic. I was in the emergency room. So I really got a nice variety in that first year, which I feel like is what you should be getting if you're then going off to do a specialty. This is the last time I may be working with patients in some of these different settings. And lastly, I enjoyed my transition year because I was able to work at a small community hospital. And traditionally in training, in residency, you're usually at big academic centers, which is where I'm going next. It's going to be at a big academic institution. And so it's a different type of setting that you get to practice in. And I thought being in a small community hospital for my first year, my intern year, was nice. You get to know everybody. Not that you don't at these big academic centers, but they're a lot bigger. There's a lot of different specialty services. So it's just a different way of practicing. And I thought it was an overall good experience for my first year. For any of you who are about to start residency, intern year, good luck. A couple tips is be friends with the nurses. If they're your friends, your life is going to be a lot easier. Just go in and try to learn and do your best. Be on time, be professional. If you could do that, you're generally going to get through intern year just fine. All right, guys, hope all is well. I'll see you in the next video.